Okay, I think we're live on YouTube, so just make everyone aware of that. We are still waiting for a few folks that we were expecting, so we'll just hold off for a few more minutes to get started. So Tammy,
me?
Tammy, you, do
Okay.
you mind, would you mind, since we don't have our chairs here, do you mind, we can defer the, any votes for now. But we do have Amanda West here from the council who was going to do a presentation. So do you mind just kind of opening the meeting and then maybe moving right into the presentation, and we'll come back to any voting if we get our quorums and other folks join.
Okay. So I call to order the June 10th Community Services Board meeting for Warren and Washington County. And we have a presentation.
Yes, we have Amanda West from the Council for Prevention.
Great.
And we can just turn it over to Amanda. Thank you.
Hi, everyone.
Hi,
Thank
Amanda.
you for having me.
Hi, Amanda.
Hi, everyone. Okay, so I'm going to share my screen, if it will let me. Can you guys see my screen?
Yes.
Okay. Woohoo! All right. So thanks for letting me share a little bit about what the council does. As probably many, if not all of you are aware, that we are your local prevention provider, and we cover two counties. We cover Warren County and we cover Washington County. Okay. So really our mission is to make connections within the schools, with families, throughout the community. We support and we encourage collaboration, and obviously that we address the issues of mental health, substance use, disease prevention, treatment, and recovery. Part of us, we have the Hope and Healing Recovery Center. So that's kind of an offshoot of the council. So why prevention? We know that the younger we can speak with youth, the less likely, that is the hope, right? They are to use drugs or alcohol. So using those consistent messages with youth, having it come from parents, peers, teachers, members of the community, the more that they are hearing those messages, the better. So essentially everything that we offer at the council is evidence-based. And we say evidence-based because there's research that backs that up, and it's proven that it works. So the majority of basically all of our programs address risk and protective factors. So reducing those risk factors and enhancing those protective factors. That's really what all of our programs provide. So our most popular program that we have in school districts is our Too Good for Drugs program. There is also a Too Good for Violence program, but the Too Good for Drugs really is really the go-to that a lot of school districts ask for. And it covers grades K through 6. It is a universal prevention program. And what's really neat about these curriculum is the lessons build upon each other, and the lessons that are appropriate for first grade is appropriate for that same group of kids when they move up to second grade. So they build upon each other. And really it's, teaching them how to be socially competent problem solvers. And, they learn things like goal setting and decision making and teamwork skills. And it is interactive. Learn about negative consequences, drug use, the benefits of nonviolent drug-free lifestyle. So this is a universal prevention program. One of the other programs we offer is the Botvin Life Skills program. And really it's geared towards grades 6 through 12. Same thing, it's universal. The lessons build upon the next, again, with the goal, preventing alcohol, tobacco, marijuana use, and violence. It targets social and psychological factors that promote the initiation of substance use, and also gives life skills that really helps build resilience in the youth so they can navigate a little better through difficult situations. There's a lot of role play, small group activities, things like that. I think coming from a prevention standpoint, and this is a whole other topic, but the legalization of cannabis is going to be a little tricky. And it's tricky right now because we already have our educators are physically in schools right now. So that has been a long time coming, but they're in the school buildings. And what they are hearing is younger grades talking about, use and their parents' use, and it's okay. And so I feel like our programs need to shift a little to, go with the times that we probably all knew was coming and that is now here. So that will be tricky to navigate moving forward. One of the additions that we had taken on several years ago was our adult mental health first aid and our youth mental health first aid. Adults is for dealing with adults who are in a mental health crisis, and youth is for, it's intended for adults to learn how to help young people. The newest addition is the teen mental health first aid. So this is really geared towards youth in grades 10, 11, 12. And it's 6 sessions, and 2 of our staff go in and teach it. We did start this several months ago in a local district, and they loved it so much. The kids got so much out of it that they actually asked us to go back. So that was kind of our first baby with this. So we anticipate that this will be a hot topic going forward. One of our other programs that we have is a challenge-based program. We have the Adolescent Challenge program that we partner with. BHSN holds the contract, and we partner with them on an adolescent program that's a 4-month cycle for any teen with a substance use disorder. So basically they will get their treatment, and we do the adventure-based activities with them. In a pre-COVID world, obviously we had more flexibility as far as our outings, and the cycles consisted of a couple of overnights, at least one per cycle, where we would take the youth camping. They would sleep in hammocks, they would sleep in lean-tos. Obviously, we have not been able to do that, but we have high hopes of getting back to doing that. Really, it's the whole design of the program is to get the youth outside of your typical four walls treatment. It's to get them out in the outdoors and experience things that they might not have ever had the chance to do or that they've never tried before. So just really exposing them to new opportunities. They're all fun outings, all recovery based. And there is also a family component as well. So for example, tonight, the challenge program has a family night that we will have at the council. And yeah, so we work closely with a CASAC from Center for Recovery. But just to note on that, we at the council are all self-sustaining when it comes to mountain bikes, cross-country skis. We have a 12-passenger van and a trailer and kayaks and canoes and snowshoes and everything, you name it, we have it. So we are able to, go out and do these activities. We also, the adult version of this, really, we have a court outing program, which is for the adult population, but they go out and they're able to, get their treatment elsewhere and partner with Spencer here at the council, and they go and they do similar activities. They did horseback riding, they do rock climbing, they'll do mountain biking. So if there's anything we have learned from being home or remote, if there's anything that this pandemic has taught us at the council, is to really get creative and think outside of the box. And so last year at this time, we were trying to think, okay, we can't be in schools. Kids aren't even in schools. What do we do? How can we support our students and how can we support our school districts that we service? So every program that we have converted to an online version. Took a lot of time to do, but staff has been busy doing it. So anything that you see, we can do online. On top of that, we had a lot of one-time presentations. So one-time presentations are things that can be done in a class period. So basically you pick a topic and our educators can teach it. We have opioids, addiction, overdose, and death. It's really an 18-minute video followed by a discussion. Marijuana, does legal mean safe? Obviously, there's more to come out of that. Juuling and vaping, what the latest research reveals. And then we also have the More Than Sad, which is around teen depression. And that's by the American Foundation for Suicide. We also have an alcohol literacy challenge that we still offer it, even though Oasis doesn't necessarily let us put it on our work plan because they don't consider it an evidence-based, but it is evidence-based. So we do still offer that to school districts. One of our newest babies, and then the pandemic hit, is we have a giant brain. You can literally walk through it. So we were able to lease said brain for 2 years. Well, we lost a year with COVID, so they were actually more than willing to extend our lease. So we were very excited about that, but we have used this so much lately. And basically it just gives kids a hand-on, if you will, walkthrough of the brain. Our educators have a curriculum that goes with it, and just it gets kids thinking about, understanding our inner workings of what's going on in our heads, especially when it comes to addiction and mental health. So the brain is also available if anyone is interested. We do have vaping presentations. We have a vape escape room that our educators had been going into school districts, and we would go and do health classes. And, the latest trend, well, a couple of years ago, was escape rooms. So we kind of made our own with, we call it the vape escape room, which youth go through and they have to solve all of these puzzles, and they learn along the way what vaping will do to your body. This also can be done online as well. The escape room is recommended for grades 4th through 8th. And then we also have a vaping in the brain presentation that's recommended for high schoolers. And this same presentation is also available for parents. And that was one of the things that came up, was we would have a lot of calls from parents or caregivers saying, how do I talk to my son or daughter or my foster child, or, what are some of the signs and symptoms that we should be looking for? So it really prompted us to put more focus on this. So parent presentations, vaping in the brain, like I said, and we also have an isolation and depression in teens. We've also converted our unseen scene, which is what might not be seen in a teenager's bedroom. And that's where we would hide a lot of paraphernalia in our makeshift room, if we could be in person. And then parents would have the opportunity to go through and see what they can find, if they could recognize any paraphernalia. We try and keep up with the times as best we can by actually going into shops and purchasing it ourselves, so we can keep up with what teens are using. That can be done online as well. So if anyone has interest in that, that's available. And then lastly, another parenting program, we have active parenting, and we have 3 programs. We have active parenting of teens, which is our most popular. We also have active parenting for parents who have children birth through 4, and then another parenting program for parents who have children ages 5 through 12. So basically, learning nonviolent discipline techniques, teaching mutual respect, the power of communication, and successful communication skills. And that can be done in 2, 3, 4, or 6 sessions. And then lastly, we are looking into, it's due next week, but a training opportunity through OASIS with the Parenting Inside Out program. They're offering 2 training spots for agencies, first come, first serve basis. But really, the Parenting Inside Out program is geared towards criminal justice involved parents. So parents who are on parole or probation. So we've been trying to put the feelers out with both, how can we make this work? My only concern is it's a little lengthy, but I think that it would be good, and it would be something else to be able to bring to parents. Other than that, that's the council in a nutshell.
Okay, well, thank you very much, Amanda, for the presentation, and really have to thank you and your staff too for the tremendous job that you do providing these services and programs. Makes a definite impact in our community. I had one question to start off with, and you may have mentioned this. I got called out of the room for a moment, but in terms of the coalitions that you're involved with, your agency has been very active with several coalitions in the community. Did you mention those, or could you mention those?
I did not. So Allie runs our Warren Washington Suicide Prevention Coalition, and I actually stay out of the coalitions. I have been out of the coalitions actually for a year. And then I don't know if you guys renamed it, but the Criminal Justice Community Service Task Force. So that she is a part of as well.
Yeah, and thank you for your involvement, or your agency's involvement in those coalitions. They're really leaders in both of those. Allie is. And also, folks may be familiar with the Criminal Justice Community Service Task Force, sort of merged with what was the Hometown versus Heroin, which was a homegrown group out of your agency. And so those two groups came together now to be one. And I think they're in the process of deciding on a name. But yeah, so are there other questions for Amanda?
Amanda, the one-time presentations, I think is what it said on the slide that you had. One of the things at the top of the list you said is like an 18-minute video and then conversation. Are those things only angled towards classroom settings, or might they be something that could also work, say, in my agency for staff?
Yeah, they can be geared towards, it's just, we mainly do them in the schools, so we are adaptable. Yep.
Okay. There was some good stuff there. I think, definitely I'd be interested in doing for some development here.
Yeah, sure. One thing I forgot to mention too is we also have the student substance use survey that we were slow out of the gate in 2020, just because 2020 was 2020. So we only had a handful of school districts do our survey. We do have more that are willing to take it in the fall. So if any of you can put the plug out there for districts, I go back to our work plans and our needs assessment on that. And we need the data, and we, especially in a time like now, to see what has changed with our kids, because the initial results are a bit shocking. So if we are able to get more districts who are able to take it, then we can have a better comparison countywide and by countywide, which would really be interesting to look at in comparison with our other years. So not too successful with that, but we have hope.
Amanda, I would just like to say, one, I just think it's amazing how much guys have been able to do, you and your staff, in, with the year that has transpired here, that you've been able to keep everything going, to put everything virtual. I mean, you just should be commended for all that you've done and continue to grow, and with the changing times with the legalization of marijuana. And I think the student substance abuse surveys, that will definitely be an eye-opener, I think, for a lot of, not necessarily surprising, but to actually see the data for staff and parents and the community see, in terms of, I would anticipate there'd be some great changes in regards to substance use and mental health, given what's transpired the past 18 months. So keep up the good work.
Thank you, Michelle. Staff has been great. They've been flexible, and I can't ask for a better staff. And we have a full-time finance manager who started at the end of February. So she's been a breath of fresh air. That's it. Any other questions?
That's great. Yeah, the fall may be challenging, right? With the kids back in schools. Everyone back.
Fingers crossed.
All right. Any other questions or comments for Amanda? All right. Thank you so much, Amanda.
Thank you, everyone.
Okay, so I think what we probably need to do is go, in terms of having it on the record, maybe go through and have everyone introduce themselves. State your name and the county board that you're on, or for our guests, your affiliation, agency, etc. So let's see, I'm just going to go across the screen as I see folks. First I see Tammy
Again, me, Tammy.
DeLorme. Thank
Did you
you.
know
I should have just introduced you.
It's got the Warren County, it's got the Warren County IT person there, so I just checking. Tammy DeLore,
Right.
Washington County.
Okay, now I see Cindy
Cindy Watson, Warren County.
and Michelle.
Michelle Burke, Washington County.
Okay, I see Belinda.
Belinda Bradley, Warren County.
Thank you. Oh geez. All right, Linda.
Linda Mashad, Washington County.
Hello. Amy.
Amy Malloy, Warren County.
Okay, Dean.
Dean Klickner. I'm in Warren County. I work for Warren Washington Rose House.
Thank you. Okay, Chris. Is Chris Hanchett still with us? Hey, Chris, you're up.
He looks frozen.
Yeah, I think Chris Hanchett is the Warren County Commissioner for Social Services, and he's on our Warren County Community Services Board.
Looks like I got cut off there.
Holly, hello.
Hi, Holly Urian, Warren County.
Okay, Chris, thanks. We got you. Holly?
Hello. Holly Urian, Warren County.
Thanks, Holly. My computer keeps freezing, so I apologize. Paige, are you available?
Yep, I'm here. You froze, so I couldn't hear you for a couple seconds. This is Paige. I'm the Director of ACT for
Yes,
Warren,
sorry.
Washington, and Saratoga counties.
Yes, welcome. Thank you. Let's see. Do we have Nicole?
Hi guys, Nicole Trottier for Adirondack Peer-to-Peer for Warren and Washington County.
Welcome. Thanks for joining. Let's see. We have Jennifer. BHSN.
Hi, Jennifer Hill. I'm the director for BHSN Center for Wellbeing and the interim director for Center for Recovery as well.
Okay, and Crystal is on.
Hello, Crystal Mallory, Secretary for Community
Crystal
Services.
Mallory. Great, thank you. Mary. Mary McLaughlin.
Hey, Rob, I'm sorry. I'm back. I had to walk away for a minute. Sorry about that. Can you hear me? Can you not hear me?
Yes, now.
Oh, okay. That was
Yes.
weird. That was weird. I'm sorry. I had to walk away for a minute and I came back, but then you weren't hearing me, so I wasn't sure. Can you hear me now?
Yes, we can.
Oh,
Yes.
okay. All right. I didn't hear the introduction. Did you want me to give you an update for the North Country Care Coordination Collaborative? I didn't hear what your question was. I had to walk away for a minute.
Sorry, Mary. We were just running through introductions to get on the record who was attending the meeting today. So can I put you down for that update in a few moments?
Yeah, or another meeting as well. Whatever works for you is fine. I'm sorry that I got mixed up with that there. You guys are very tolerant. Thank you.
No, that's fine. Yeah, thank you. Now I have someone on a phone at the last four digits, 5480.
Hi, yeah, it's Jerry Brennan from OPWDD.
Oh, hello, welcome. Okay, I'm looking across my screen. I think I hit everybody. If there's anyone I missed. Okay, if not, I think Warren County has a quorum and could approve minutes from the May 13th meeting. But let's see, we don't have Kim. And we don't have our vice chair either. Is someone willing to take a motion and a second and ask for approval of those minutes?
I could do that. Is that all you need is ask for a motion? You might have to walk me through this, but yeah, I can do it.
Yes, sure. I need you to ask for a motion to approve the minutes of the May 13th, 2021 regular meeting.
Okay, so
For
for
the
Warren
Community
County, can we
Services
have
Board.
a motion to approve the May 13th minutes of the regular meeting for Warren County?
Here, Chris Hanchett.
Thanks, Christian. And
You're
second?
welcome.
Second it.
Thanks, Belinda. And is there any discussion? Okay, all in favor?
Aye.
Aye.
And if not, yep, if not, move to a vote then.
Okay, a motion approved.
Amy, you did that like a champ.
Did I do that okay? Okay.
Yeah.
I've been at a few of
Very
these
good.
meetings.
So it's time for Washington County, Rob?
But we don't have a quorum for
Oh,
Washington.
okay.
So we will have to hold off. And I apologize, when we were doing introductions, I didn't introduce the room here. So I'm Rob York, Director of Community Services.
Eric Carlson, Community Services.
Harry Wright, Office of Community Services.
Adele Potter, Washington County.
All right, so I think we're one short, Tammy, of a quorum for Washington. So we will defer Washington until the next meeting. And let's see, I just have a few informational items, and then Mary had something to share with us also.
Rob,
Yes.
according to my count, we have 5 for Washington County. Am I incorrect?
No, you're probably correct. Can you remind me who those folks are? I've got Michelle, Linda, Tammy, and Adele.
Adele, Tammy, Michelle, Melinda. Oh, nope, never mind. I'm sorry. I guess I put Belinda as Washington and she's Warren.
Yeah, so I think we're one short there, so that's okay. We'll catch those up next time. I'll go ahead and run through the informational items. We have our Community Services Board Budget Review Committee meeting later this month. There's an attachment to the email link that went out, that Crystal had sent out, that has a schedule attached with a memo for the members of the budget review committees. And so we'll be meeting with our agencies and reviewing their 2022 budget submissions. And once the budget review committee has approved those, then we'll be bringing those forward to the full board for your July meeting. We may split some of the agencies to have some present in July and some in September, just depending on how our agenda is looking for July meeting. So that's just informational for you. If any of the newer members are interested in the budget review committee, you're happy to join in. Or if you want to spend some time looking at agency budgets, we're happy to share those, even if you're not on the committee. All right, also the 2022 local services plan update, and Carrie has been working diligently on our plan. So I will see if Carrie would like.
Sure. Are you all able to hear me?
I can hear you here in Warren DSS.
Okay. Just making sure. Okay.
There's an easy solution here.
Yep, so as far as the update for the local services plan, we just tweaked it a little bit from last year. Like I mentioned, we did a lot of work on it and did a nice overhaul last year to really encompass a lot of the law enforcement reforms that are happening. There's a lot of work around that was pertinent, as well as some of the peer-based services. So we're still adding and tweaking a few things, but not a whole lot has changed. So the majority of that will stay the same, but we're going to look to approve that next month. So we just asked for an extension. It was due a little later this year with COVID, so it should work out just fine. But if anyone, again, has feedback, questions, anything on that process, feel free to email me. Thank you. Oh yeah, and law enforcement initiatives for the updates. So we are working or have been talking with AMH, is that fine to mention their role and all that, to sort of be the lead agency on the LEMRs. I think most of you are familiar with the LEMRs platform. Essex County has done numerous presentations, probably on some of the committees and meetings that you sit on. So Doug from Essex County has really been helpful to us in walking us through that process. Glens Falls PD in the past has been on board with using that platform as a referral source to refer folks that they may run into that have some mental health or substance use issues that could then be referred, so not crisis services, but kind of those wraparound warm handoff services that law enforcement would be able to refer individuals to. So we're working with AMH on that, on the new platform that Essex County is utilizing so that they can get that up and running and eventually just print out, it's like a business card that says Lemurs. It'll say the 2 counties on it and have the website address. But we haven't done much with law enforcement right now until that's ready to go because, you know, they have so many initiatives going on right now. Any other law enforcement? There's so much, yeah. Okay, thank you guys.
Very good. Thank you, Carrie, for that update. And again, I apologize. Our connection seems a little unstable. It keeps freezing. So I hope you're able to follow along and get the information. And then I think Mary McLaughlin had mentioned Mary, are you available? You do want to do the North Country Care Coordination Collaborative piece now?
Sure. Yeah, I can do that. No problem. I just wasn't sure. Have we talked about it before here? I get confused.
I think you've mentioned it in some of your updates, but we've never done it. I don't believe we've done a presentation or anything in depth.
Okay, well, maybe I can just share my screen to, you know, show a few slides that'll just be helpful if I can figure that out. Let's see.
If you can't, I believe I have those slides in an email that you sent me, so I could pull that up if needed.
Trying to figure out what are we in here. Yeah, I'm having trouble figuring
You
out.
want me to try?
I could try this. What are you looking at now? Are you looking at it?
Yes.
Oh, yeah. Well, okay. That worked better than I thought. All right. So the North Country Care Coordination Collaborative is a HRSA grant that CVPH received on the part of the region. So it's 6 county regions: Warren, Washington, Franklin, Essex, Hamilton, Clinton. Am I missing one? So it was received through CVPH. The Adirondack ACO is doing these administrative support, and the project management is coming out of AHI, which is how I'm involved in this. The goals of the project are to support transitions, and that would be both out of psychiatric inpatient stays and out of acute medical hospital stays from the 5 hospitals in the 6 county region, using care coordination services for high-risk patients. So there's essentially 4 goals. We're trying to build the collaborative, and that's been wonderful. We are kind of springboarding off of DSRIP work and ACO work and other initiatives throughout the community, the IPA, Northwinds IPA, and other things. So the collaborative was well underway pretty quickly and has grown. For example, we added Rob and other community services board members from those counties. We've added Office for the Aging. We've added Fidelis and Managed Care Organization and other behavioral health organizations to help support this collaborative. What we've been doing is sharing best practices throughout the region and then trying to make sure that we are able to replicate those across the 6 counties. The goal is not to create new services, but rather to collaborate and connect and be better stewards of the services that already exist through then the next goal, which would be communication using HCSCN to share who is at risk of needing care management. So who is higher risk, and we're planning on using the similar criteria that we use for Health Home. And then also, simple thing, but sharing who is currently offering care management services to an individual. That is not something that's easily identified. And so using HCSCN, which is the regional health information exchange for our area, which takes information from providers and hospitals and collates it in one spot. So you can either go to that system or get alerts into your electronic health record from that system. So they are really being a great partner in helping us with that component of the sharing of communication and information. And then we have some workforce development aspect of this, focusing on patient-centered care, things like motivational interviewing and trauma-informed care, excuse me. And also, we're going to add a component that discusses vicarious trauma to support retention efforts of care management staff. Some of the work groups that have emerged from this initiative so far are the risk stratification group. So that's a group that's trying to figure out what's the best way to identify the high-risk patients in HCSCN. We have a group that identified the performance measured. It is a HRSA grant, so we have to report data. And the goal there is to use existing data sources rather than ask individual providers for information. So using ACO claims data, HCSCN data, IPA is helping us with some psyches data. Nice collaborative with Fidelis. They do care management services, but it's often difficult to know whether someone is offering a client services from Fidelis or how to get a hold of them. So trying to put together some workflows that help that. The Office for the Aging has fabulous programs, both for Medicare clients and others. And so we're working with them to leverage that resource. 3 of the 5 hospitals, and I think you guys have heard of what Glens Falls Hospital does related to substance use treatment, handoff. So if someone's in the hospital for medical admission but has a contributing factor of substance use, a provider, substance use provider, just talks with the patient while they're in the hospital, which is a good motivational time to talk to someone about treatment. And so that has increased the number of people that go for substance use treatment post-hospitalization. We're just starting some work to leverage adult protective services and see if we can better collaborate there, and then working on the workforce strategies. These are a snapshot of the individuals that are involved, or organizations, I should say, they're involved. So the 5 hospitals, some other convening organizations, and then individuals, both post-acute, behavioral health, home care, SNFs, care management agencies, so quite an array of folks. And then this slide has, which you can't read, but has the individuals that are involved. So did anyone have any questions or suggestions or questions? I don't know, anything. It's an exciting initiative. I think the work that was done previously really has been fertilized the soil. So this is really just taking off. And actually, it's interesting because there are 9 other organizations that receive this grant across the country. And whenever we're with other organizations on peer calls and whatnot, it's very clear that the North Country has done some really innovative and exciting things that has given us kind of a lead compared to others, which is very encouraging. Sometimes you're so entrenched, you don't realize that good things are happening. So it's exciting. Okay. I think that's it. Anything I left out, Rob?
No, I don't think so. Mary, I do appreciate the presentation, the information, and I appreciate you reaching out to me to see if I wanted to be involved. I think, you know, it's probably most helpful for the providers that provide the actual care coordination, you know, to be getting together and collaborating on these things. But it's helpful for me as well in my role for some aspects that they're exploring, such as looking at individuals who have high occurrence of either hospitalization or, you know, we have our own, I guess, processes where we're trying to identify people who maybe, you know, come in contact with a hospital or emergency room or police, and trying to make sure that there's follow-up that occurs. And so that's part of what this group is doing in developing that HCSCN relationship, where they can get some data. People will be given that risk score, and then there, you know, is a focus on the high risk individuals that are identified. So thank you, Mary. I look forward to being part of it.
Thanks, Rob.
Okay, I know we have some providers that are on our meeting today as well. I see Nicole Trottier from the Adirondack Peer-to-Peer had to hop off for another meeting. But do any of our providers have any updates or information they want to share today? Okay, I'm not hearing anyone. Thank you though for joining us and being part of the meeting. One other thing I just wanted to mention, I guess, that there were 2 letters of support that I did provide for Behavioral Health Services North. They had come to me with a request. They were putting together a federal grant application, and it was to develop some crisis beds for children. And this would actually be located in Clinton County, but the catchment area would include Warren and Washington. So even though it's a distance, I was very much in support of that because there, definitely a shortage of crisis beds for children. So when we speak with them next, we can ask them to, elaborate a little bit more on that project. And then also I provided a letter of support for them for some school-based services in Minerva. Now, this deserves a little bit of comment because initially I told them, well, the Minerva School District sits in Essex County, so you need to get a letter of support from them. But in exploring things a little bit with them, Minerva does serve some children that live in northern Warren County. So I was able to provide a letter of support advocating for those services for the children in northern Warren County. And those services were being provided by Northern Rivers previously. They had a clinician who was splitting between Johnsburg and Minerva. And that was the plan for Behavioral Health Services North also, was to have one clinician sharing the 2 schools. So it really was a continuation of what was previously planned to be delivered by Northern Rivers. Okay, any questions on the letters of support? In general, my approach to this, and I think the board has always supported this, that if these requests are in line with our approved local services plan and, in line with the goals and such of our plan, that the board has previously approved the plan and that we don't have to bring every single request through the board. But I do try to keep you informed, as we go along, different letters that I've written.
Yeah, that makes sense, Rob. Thank you for those updates too. Appreciate that.
Okay. Does anyone have anything else to bring before the board today? If not, Tammy DeLorme, would you mind closing the meeting for us, please?
I actually was on to it this time and anticipated that was what you were going to ask for. Is there a motion to adjourn?
Motion to adjourn.
Woohoo! I see a second from Linda, and we can combine our efforts together, Warren and Washington County.
Yeah.
We're adjourned. Take care, everybody.
Thank you, everyone.
Take care.